Good morning and welcome. Today I'm joined by Andrea McLellan, Director of COVID-19 Immunization Strategy, who will speak about the COVID-19 vaccine rollout, and Dr. Carol Zimbalatti, Public Health Physician, to provide an update on the local COVID-19 situation. The state of the pandemic is worsening across the province. Although locally, the situation is not as dire, we do need to continue to exercise caution. This week, a report from the Ontario Science Advisory Table informed the Ontario government that the pandemic is at a tipping point in our province. There are reports the Premier may announce a provincial lockdown later today. We await the details, but we urge you all to please continue to follow public health measures. I know this will be difficult for all of us, for our financial well-being, for our social health, and for our mental health. Small businesses have been particularly impacted by the uncertainty and ever-changing restrictions from week to week. This is why I've said the quickest path for reopening is not reopening too soon. I do believe, however, that further restrictions are necessary for the following reasons. As of March 30th, variants of concern, or VOCs, account for 69% of all COVID-19 cases in the province. Compared with earlier variants of COVID-19, VOCs are associated with a 63% increased risk of hospitalization, 103% increased risk of intensive care unit admission, and a 56% increased risk of death due to COVID-19. In short, these variants are more contagious, they result in a more serious illness, and are deadlier. Provincially, the number of people hospitalized with COVID-19 is 21% higher than at the start of the province-wide shutdown on December 26, 2020. We're also experiencing a shift in the demographic of who is being seriously infected with COVID-19. Provincially, the percentage of patients in ICUs who are younger than 60 years of age is about 50% higher than it was prior to the start of the province-wide shutdown. On the bright side, locally, we are not experiencing the same increases. I do believe that we need to get the provincial numbers under control. Our neighboring health unit regions continue to see an increase in cases. And as I said before, we're not an island, and without appropriate interventions, it is only a matter of time until we experience increases. It is important that we all continue to follow the public health measures. Limit contact to household members only. Travel outside the home should be for essential trips only. Physically distance and wear face coverings or masks, and again, wash and sanitize your hands often. Until widespread vaccinations are completed, which will not be for months, these public health measures are the best way to protect the health and safety of everyone in our district. Now I'd like to hand it over to Dr. Zimbalatti to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. Our neighbor, Public Health Sudbury District, had 316 active cases as of yesterday, and Simcoe Muskoka was reporting 447 active cases. In the past week, we have had 6 new cases, bringing our total case count to 293, with 196 in the Nipissing District and 97 in the District of Parry Sound. We currently have 6 active cases, none of whom are isolating in hospital. As of yesterday, we have had 54 preliminary or confirmed variant of concern cases identified in our district. This week brings with it another holiday, followed by the planned April break for schools. By following public health measures, we can help to prevent a surge in COVID-19 locally and keep our children in school. We know how important it is for students to continue in-person learning. Many students in our district face barriers to distance learning, and in some cases, barriers that go beyond access to internet and technology. Being at school with peers has a positive impact on a child's social, emotional, and physical well-being. We will continue taking all necessary measures to keep children safely in school if there is a provincial lockdown. I'd also like to provide an update on our outreach with municipal leaders. This week, we are hosting our second bi-weekly meeting with the leaders of our member municipalities. At our last meeting, municipal leaders were unified in their concern over the provincial allocation of the vaccine to our community, and all agreed to advocate for their local councils to pass motions advocating for greater access to COVID-19 vaccines in our district. With that, I will pass it back to Dr. Chirico.
Thank you, Dr. Zimbalatti. I'll now pass it over to Ms. McLellan, and she will provide an update on vaccine rollout this week.
Thanks, Dr. Chirico, and good morning, everybody. Thank you for the opportunity to be able to share with you an update on our vaccine rollout. As of 3 p.m. yesterday, we have provided 16,682 vaccinations in our district. 14.8% of those 18 years of age and older who are residents of our district have received at least one dose of the COVID-19 vaccine. In an effort to provide the public with an up-to-date in order to provide the public with up-to-date information about vaccines, our website now includes vaccination data that will be updated on a daily basis. This past weekend, we opened our COVID-19 clinic appointment bookings to individuals 75 years of age and older. Over the Easter weekend, the health unit will be hosting clinics at Memorial Gardens. Clinics for this weekend are open to adults born in 1946 or before, as well as for community health care workers who have received their email code from the Ministry of Health. Additionally, adults 70 to 74 years of age are also able to book appointments this weekend by calling the health unit's call center to book that appointment. Anyone who requires assistance booking an appointment is encouraged to contact the health unit and follow the prompts to reach our call center for help. We continue to advocate with the province for greater access to COVID vaccines. Our vaccine clinics have been a tremendous success across the district, and I want to recognize the efforts of all those who have worked and volunteered at our clinics. We couldn't do this without them. We have received tremendous support and positive feedback from those who have received their vaccine at our clinics. We've had an amazing response to our request for volunteers, and at this time we don't require any additional volunteers, but this is not a short-term process, this is a long-term process, and we will require more volunteers as we move forward. So we have a volunteer page on our website that we would suggest people refer to for updates as to our requirements for volunteers. I know there have been a lot of questions about the AstraZeneca vaccine. To date, we have not been provided with any AstraZeneca product and do not know when or if we will be receiving this vaccine. However, in the event that we are provided with a supply of AstraZeneca, we will use it in accordance with the recommendations of the Ministry of Health, the National Advisory Committee on Immunization, and Health Canada's recommendations. And with that, I'll turn things back over to Dr. Chirico.
Thank you, Andrea. And that's it for our remarks. So now we'd like to begin answering your questions. So if you have questions, please type them into Q&A at the top of the screen, and our moderator will read them out loud, and we'll try to cover off as many as we can. And when possible, please ensure that your name is attached to the question. So Alex, if you could, please start with the first question.
Thank you. The first question is for Andrea. It comes from Chris Dawson from Bay Today. How close are we to getting pharmacies and doctors' offices helping with vaccine rollout?
I think we're very close. I don't have a specific date, but the province is ready to start looking to allocate vaccine to pharmacies and primary care. So I anticipate that will be within the next few weeks.
Thank you. Dr. Chirico, this question is for you from Clark from Cogeco News / Your TV North Bay. Thanks for taking my question. The Northern Freedom Alliance has planned a freedom rally taking place this Saturday afternoon at the North Bay waterfront. They will be calling for an end to lockdowns. Is the health unit monitoring this? What is your message to the organizers and participants?
Well, I have concerns when people certainly have the freedom to express themselves, but I think my concern is that it puts people at risk when you're not physically distancing, when you're not wearing face coverings when that happens. And I think that that is something that I hope that they would reconsider, because it puts everybody's life at risk. We are aware of this happening, and we would want to discourage them from doing that. And I hope that they will understand the reasons behind that, and that the province is in a serious situation right now, and we need to protect everybody.
Thank you. Dr. Zimbalatti, this question is from you, from Jennifer from the Nugget. It reads, what is your stance and recommendation when it comes to in-class learning?
Thank you, Jennifer, for that question. So locally, we haven't experienced COVID-19 transmission in schools. The school boards and transportation services have done an excellent job in keeping our students safe. The health unit has also acted swiftly and decisively when there have been cases associated with individual schools. We all take the safety in schools very seriously, because we recognize how important attending school in person is to children and youth's mental, social, and physical well-being. Additionally, many students in our district face barriers to distance learning. In our district, we will continue to advocate to keep schools open while case counts remain low and there is no transmission in schools.
Thank you. Our next question is to Dr. Chirico from Jennifer from the Nugget. Is there concern over COVID-19 fatigue? Residents say, what's the point when the province is going to lock everyone down anyways? So does the framework even matter anymore?
Thanks for that question, Jennifer. And you've raised a very important point, and that is that, yes, people are fatigued. And certainly everybody has suffered and sacrificed over this past year. And nobody wants this to be over more than all of us. I think that the important thing that we have to understand too is that we can't ignore what's facing us, and that we have to take measures, because the quickest way to have less of an impact and to be able to open and sustain that opening is to impose significant measures now, and that we all have a choice individually to adhere to them. There's a lot that we can do. On a positive note, we were very successful in the first wave to flatten the curve, to slow the spread of the disease, and we were able to have a summer that was reasonably normal. Some restrictions in place, but it was certainly something that people enjoyed. And I hope that we can do the same. But the only way that we're going to do that is to, unfortunately, take the harsh medicine that we have to take. And if we do it now, if we do it over the next 3 to 4 weeks, then we can look forward to a much better summer to come.
Thank you. I have 2 similar questions. So the first is from Kate Rutherford from CBC, and these will be directed to yourself, Dr. Chirico. The province is expecting to announce a shutdown or lockdown today. What do we know about this, about how this will affect the North Bay Parry Sound District? Will there be significant changes? And then adding to that, Eric has a similar question, just asking if our district will also be included in this.
Right now, it's too premature. We have not received any indication of what the Premier's plans are at this point. And certainly we will be following it. And once we find out what the measures are going to be, then we'll have a better idea of how to assess them.
Thank you. Our next question is for Andrea. It comes from Chris from Bay Today. How do individuals get on a standby list for COVID-19 vaccines? Or what is your process when people don't show up for their appointment?
Thank you for that question, Chris. We don't have a formal process for people to get onto our list. We're trying to accommodate people following the provincial framework and the groups that we're providing vaccinations to. And we often have staff and volunteers at the clinics who fall within that highest priority group who have not received their immunization. And so we've been immunizing those individuals. So we are looking to expand that because, of course, as more people are immunized, less people working at the clinics will require vaccinations. So we will be looking to develop a wait list of individuals that we can call in the event we have vaccine left over at the end of a clinic.
I would just like to add to that, in that since we've begun our immunizations, not one dose has been wasted. It has gone into an arm.
That absolutely.
Thank you. Our next question is for Dr. Zimbalatti. It comes from Sarah from the North Star. Has the West Parry Sound Health Centre received any patients from other Ontario hospitals that are experiencing an increase in COVID patients?
I think that's a question to direct to acute care, since they're the ones that are receiving potentially any patients. That hasn't occurred to my knowledge, but like I said, direct that question to acute care, please.
Thank you. This question is for Andrea from Jennifer from the Nugget. Can residents leave the district to get vaccinated? Under what circumstances would a non-resident be allowed to be vaccinated?
Thanks for that question, Jennifer. Residents are encouraged to be immunized within their district. The provincial booking system that is being used allows you to book outside of your district if you are eligible within your district. So you're not restricted to booking within your area. You can book anywhere in the province that you want to. However, we strongly encourage you not to travel outside of the district and to book your appointments if you're eligible within our vaccination clinics.
I'd like to add too, if I may, exactly what Andrea was saying, that please, we ask that you not travel outside of district, especially if we are going to get control of these variants. We strongly discourage anybody from traveling anywhere outside of anybody's district and going to other areas. So we really implore you not to do that.
Thank you. Our next question is from Eric from CTV. This question is for Dr. Chirico. Yesterday, we interviewed staff at the hospital regarding patients canceling their appointments and not seeing their doctor when feeling unwell. What is your thoughts on that and your message to people trying to stay away from the hospital out of fear?
Yeah, thank you for that. An excellent question. I think that what we need to emphasize is that if you are having symptoms of COVID-19 and it is affecting your breathing, you need to be seen and you need to be assessed. So don't wait. If you have any type of emergency that you feel that you need to go to the hospital, don't hesitate. We would rather have people go and be seen rather than miss somebody that really needs to have that kind of acute care. So I think that from an overall strategy perspective, this is exactly what we're trying to do. And everybody has that individual responsibility, because if we can get control of these variants, if we can limit the spread, then what will happen is that it will keep our emergency departments free to be able to look after those that are really sick, non-COVID related patients that need to get the care when they are ill. So we have a lot of power to be able to control what happens in the future if we adhere to those strict measures and do it now. Because as we've pointed out, these COVID-19 variants of concern are affecting younger people. People become more ill. They end up in the ICU and on ventilators. And we need to do everything we can to prevent that. But anybody that is sick needs to be able to access the emergency department, the ICUs, and that's why we need to really work hard together to ensure that our healthcare system is not overwhelmed.
I would like to add to that, saying that our hospitals and clinics have many measures in place to keep people safe when they attend. So don't delay seeking attention for any new or worsening symptoms. Also, it's important to continue with the regular screening tests that your healthcare provider is recommending. We don't want further health problems to emerge later on due to this pandemic.
Thank you. Our next question is for Dr. Zimbalatti. The question is from Kate Rutherford from CBC. There have been outbreaks among the population experiencing homelessness in Sudbury and Thunder Bay. Do we know the status of COVID in that population in the North Bay Parry Sound district?
Thank you, Kate, for that question. Yes, it has been a major issue in other health units. We haven't seen the same, thankfully, in our region to date, but of course, it could happen if we are not careful about the restrictions that are in place and that everyone is following the public health guidance that we are recommending.
I'd also further add that we are working with our community agencies to reach that homeless population and the most vulnerable, and working with them to strategize on how best to serve their needs and get vaccines to them when available.
Thank you. Our next question is for Andrea. It comes from Sarah from the North Star. Have all Indigenous adults who choose to be vaccinated not received at least the first dose?
At this point in time, we are rolling out the vaccine according to the provincial strategy. So those individuals on the First Nation reserves who have been deemed high risk have been vaccinated should they choose to with their first dose, everyone from 18 plus. On the other reserves, which are not deemed to be high risk, everybody 55 years of age and older have received their first dose. We are currently in the process of allocating and distributing the vaccine for the 18-year-olds, 18 plus on reserve individuals to receive their first dose. And we are working with our Indigenous urban partners to develop a strategy and clinics to provide vaccine to those individuals.
Thank you. Our next question is also from Sarah, and it is directed to Andrea as well. Have there been appointment time slots at mass vaccination clinics that have not been filled, or is the response so strong that every appointment is taken?
Up until today, all of the appointments that we've had have been filled. We haven't had any vacancies. We do have clinics running over the course of the weekend, and so we have expanded who can access those clinics to receive their vaccination. So again, the 75 plus age group can make appointments. There are appointments that 70 to 74-year-olds can make over the course of the weekend as well. And healthcare providers working in the community who are our highest and very high categories have received their email from the Ministry of Health that allows them to book into appointments as well. So I anticipate that those clinics will fill for the weekend as well.
Thank you. This question is also for you, Andrea, and it comes from Jennifer from the Nugget. Is there still a 16-week wait between first and second dose, or has that changed?
That has not changed. It remains 16 weeks for everyone with the exception of the long-term care home residents, the retirement home residents, and the residents of elder care facilities on First Nations. And those individuals are immunized at 21 or 28 days, respectively, depending on whether they've received Pfizer or Moderna vaccine.
Thank you. This question is also for you, Andrea. It comes from Jennifer from the Nugget. I know the health unit has been advocating for additional vaccines. Have your calls been answered by the province? What is your recent allotment, and when is our next shipment?
Thanks for that question. No, we continue to advocate, and we have received municipal support to assist us in advocating for more vaccine, but at this point in time, we have not received additional supply above what we have originally been allocated. We received a shipment this week of Pfizer vaccine, which will be used up by the end of the week. We received 4,860 doses. Our next shipment of vaccine arrives next week, and that will be a little bit less, unfortunately. It's 3,500 doses that we're anticipating next week. So clinics will be, clinics are in the process of being booked for those, for that allocation that we're receiving next week.
Thank you. Our next question is for Dr. Chirico. It comes from Eric from CTV News. Since the vaccine administration is in 2 doses, after the first dose is given, is there any reason that it creates a false sense of security until people receive their second dose? What steps do you recommend for those waiting for their second dose in terms of health guidance?
Well, thank you for that question, Eric. That's a really important point that you've raised, and really appreciate you bringing that to the attention of people, because the message is still, we don't want people to get a false sense of security. Because you've got the vaccine, that's an important step to becoming fully immunized. However, we still need to adhere to the public health measures. We need to have people continue to adhere to physical distancing and just limit your contact to your household members and go out for essential reasons only. It takes at least 2 weeks for the immune process to work through, and so that you do get a degree of protection. But we still have to be very vigilant in order to protect one another. So please don't get lulled into a false sense of security that now you don't have to wear a mask. We want people to wear face coverings and masking and continue to physically distance.
Thank you. And then kind of on the similar line for you, Dr. Chirico, as well, from Chris Dawson from Bay Today. What is the target percentage within the region population that needs to be vaccinated before you feel comfortable lifting many of the restrictions?
Yes, thank you for that. A couple of points. First of all, nobody knows for sure exactly what herd immunity level we would have to reach. It depends on many different factors, and there are many unknowns right now to be able to determine what is the exact number. In the past, for other vaccinations that have historically, people have found that between 75–85% of the population can provide good herd immunity. But we don't know for this vaccine because it's a new vaccine. We have to determine how long the immunity will last, how effective it is. So there's too many unknowns to really predict exactly how much. And that's why we need to maintain the public health restrictions. And again, these will be restrictions that will be determined by the government based on the best available scientific evidence at the time, and informed by organizations such as the Science Advisory Table, the National Advisory Committee on Immunization. There's lots of information that they will help provide to inform those decisions.
Thank you. Our next question is for Andrea, and it comes from Brad from Moose FM. According to our website, we are on the cusp of finishing the first phase of Ontario's vaccination plan. Is mid-April still the target to move to phase 2?
I think we'll be finishing phase 2 and finishing phase 1 and starting phase 2 in a concurrent manner. We still have a number of individuals that fall within the first phase that haven't received their vaccine, that we are working with with community partners to reach. At the same time, we are going to be starting to move towards immunizations within phase 2 as well. So it's going to be a concurrent process, but I also think there needs to be recognition that we probably will never fully complete phase 1 because there will always be people coming in and out of the community that may or may not have received vaccine, and that will continue to be a need. For example, you may have people going into long-term care who haven't been immunized. Long-term care is in the first phase. So I think it's an ongoing process. I don't think you ever fully finish one. It just becomes a movement forward.
Thank you. Our next question is from Jennifer Hamilton McCharles from the Nugget. What are your thoughts when it comes to immunizing teens and children aged 16 to 12? And I will put this one to Dr. Chirico.
Sure. Thank you for that. As you well know, that there are recent studies that have included those age groups and found to be effective. I think that what we have to do is to follow the advice and recommendations from Health Canada, who would approve those age groups, and National Advisory Committee on Immunization. So right now, it's very promising. It's great to have that ability, but more information certainly, and the process has to unfold in order to start immunizing those age groups.
Thank you. And that was our last submitted question. So that will end our press conference for today. Thank you everyone who was in attendance. The recording will go up on our website, and we will see you back next Thursday at 10 a.m. Thank you.